Hi, I'm Denise Donahue. I'm a physician at the Bone and Joint Care Center. I've worked in orthopedics for most of my adult life, and I've been at the Bone and Joint Care Center for 3 years. My role is to see patients in the office. I see a lot of new patients that are new to the practice, and I evaluate them. Some of them I continue to take care of myself, and if they're candidates for surgery, I then transfer them to the care of Dr. Longenecker or Dr. McAlpin. I love working at the Bone and Joint Care Center. The patients are just the nicest people. People in this area are lovely people to take care of. And one of the best parts of it is I develop relationships with people, and then when it's time for them to have surgery, I need to send them to one of the surgeons. And I'm so comfortable sending people to Dr. Longenecker or Dr. McAlpin. I know that they're going to be taken care of really well, and I trust them completely. The Bone and Joint Care Center is a smaller practice. There are various orthopedic practices that are very large. This is very personal. We try really hard to treat the whole patient and take into account the issues in their family and their perspective on things and the difficulties that they're going through. We have a patient-centered approach in our office. Everyone cooperates, from the front staff to the physician's assistants and the nurse to the surgery scheduling person, along with the physicians, to make sure that the patient is the most important person in the room. The environment is very patient-centered, from the front office to the PAs to the medical assistants to the surgery scheduling person. Everyone works in unison for the benefit of the patient. The patient's always the most important person in the room. And people know that. When I take care of someone and give them advice or prescribe a treatment, and then they come back a few months later and they're all better, and they say they didn't really need to come in, but they wanted to say thank you and to let me know that I made a big difference in their life. And when that happens, anything can happen for the rest of the day. You're just so thrilled. Many of our people come in to be evaluated and they don't need to have an operation. We can do injections, prescribe medication, prescribe physical therapy, talk about lifestyle changes like exercise programs, or simply something like changing position that you perform your activities of daily living in. One of the things that I can think of is, somebody with shoulder pain and they drive a lot and they lean on the console of the car. That's why their shoulder hurts. Simple things like that people don't realize. So if you're having a problem, make an appointment. We'll look at you and we'll center our care around your wants and needs.